So when it comes to our assessment, I think there's one key area that a lot of us miss. Usually we're familiar with the strength testing, range of motion testing, and the education that we usually provide. But within the education category, I think we miss the boat. Sure, we educate them on anatomy and certain pain points, but the thing that we miss is awareness. What I mean is that when a patient comes into you, they are hoping that you can provide answers to get them out of pain. What we need to recognize is that they are coming in with a certain pattern. That pattern is creating pain. If they're not aware of their certain patterns and habits, it's going to be really hard to get them out of pain long term. Why? Because they're going to come into you for their hour-long session, work on getting out of that pattern, and then divert right back to it when they're at home. Why? Because they don't have the awareness of what's going on. So in this video, I want to give you 3 ways that I like to help patients increase their awareness during their assessment so you can help them get out of pain long term. Step number 1, positional awareness. What I'm looking for at this step is, does the patient understand where their body is in space, right? Because at the end of the day, how they are on the table is going to probably reflect certain tendencies they have as they're working out. So an easy thing that I like to do is have the patient lay in a supine position and really encourage them to be relaxed, right? Sometimes people are anxious. They're going to want to be straight because they know that you're assessing their body and their movement, right? So I like to say, Mr. Jones, I want you to imagine that you're just watching TV, you're lounging at home. Let your legs be however they want to be. Let your arms be however they want to be. Just be really relaxed, right? So normally then you'll see the legs start to go into their more familiar and comfortable position. From here, I'm going through 3 points: the ankle, the hip, and the shoulder. And all I'm going to tell Mr. Jones to do is say, okay, Mr. Jones, I want you to make sure you keep your feet how they are, and I want you to not look at your feet. From there, I want you to bend both arms up like this. And then without looking at your feet, I want you to just show me with your hands, are your feet in? Are they out? Is one in? Is one out? Just show me by sensing how your feet are. And so they'll give me their hands in, one up, one out, however they think that their feet are. And so this is a really good time for you to start to see how their overall body awareness is. After we go through it, we make sure they're good, they lock in their answer, and then we look, right? And so you're thinking, does their hands match with their feet? Sometimes it matches perfectly. Sometimes it looks completely opposite, right? And it gives you so much information as to how this person's body awareness is, because that's going to ultimately start to reflect how you need to coach them while they're moving, right? And so once we've now gone up to there, then I say, all right, you can relax your arms. Now, Mr. Jones, I know your hips are there nice and straight. You're laying on the table, but do they feel straight? What I mean is that, do you feel pressure on the table on one side more than the other? Again, there's no right or wrong answer. Whatever you say, Mr. Jones, is the right answer, because it's whatever you feel, right? And I always encourage you to say that, because they usually will try to tell you what they think you want to hear. So they'll understand, they kind of feel out what's going on, and then they give you an answer. It's either symmetrical, they might say the right's down, the left's down. The big point here is that they're taking a moment to just start to increase this awareness. I guarantee this is something they've never thought about before. And so just the act of going through this is really helpful to increase that awareness. Lastly, we're going up to the shoulder blades. It's the same thing. Mr. Jones, I know your shoulder blades are straight and flat on the table, but do they feel like that? Do you feel like the left side's lower and into the table more? Do you feel like the right side's lower and into the table more? Whatever you feel is the right answer. And then they'll go through that. Again, really, really simple but effective exercise to do with them, because it's going to tell you what their body awareness is, and it's going to start to get them to recognize what's going on, especially if there's a lot of asymmetry. If someone has a right leg that's out and they feel their left hip back and they feel their right shoulders back, they are walking away from this table with a totally different perspective as to how their body is. And so as you address that during your exercises, they now have buy-in. They know the value because they actually start to feel this. That's how we start to disrupt patterns and get them out of patterns long term. Step number 2, pelvis position. So now we're focusing in on one of the 2 human foundations, one being the pelvis, one being the rib cage. What I like to do here is have the patient go into a hook lying position. You're gonna have to use your imagination a little bit for this part, but a hook lying position, right? And then all I wanna see is, do they have the ability to go through an anterior and a posterior pelvic tilt? However, we don't use that language, right? What I say is, hey, Mr. Jones, I want you to imagine you have a big belt on. and that big belt has a big belt buckle. So you can imagine the big belt buckle would be like this. Can you use these muscles here, try to minimize up here, and can you move the belt buckle towards your feet? This is an anterior pelvic tilt, and then he will attempt to go through that. Then we're going belt buckle towards the chin, aka a posterior pelvic tilt, and then he'll do that. If they can't do one or the other, if they have a hard time starting, because normally once they get the momentum, they understand it, it rolls really nice. But if they cannot start, then just have them arch their back. Usually patients are familiar with arching their back, and that's going to be an anterior pelvic tilt. And then you can just cue them and say, now do the exact opposite, where the back goes flatter down. So what is this telling us? This is telling us what's going on from a mobility aspect, what's going on from a strength aspect, and what's going on from an awareness aspect. A lot of times, especially if it's someone that's in a big pattern and really, really stiff, they don't have the ability to move through that motion. They just say, I don't even know like how to do that. This seems boring, right? So again, this is helping you make exercise decisions. This is helping you understand how you're going to need to coach this person differently compared to someone that goes into an anterior posterior pelvic tilt, no problem, right? And the last thing I really like to educate on here is saying that what I want you to really recognize here is that ideally we never sacrifice this for this, right? Usually how injuries happen, usually how patterns happen is because we totally neglect what's going on here and we just focus here. Why? Because exercise tends to burn these more than these. But in general, we want to start building their education on the importance of being able to move the pelvis, having strength at the pelvis, and being aware of it. And finally, step number 3, rib cage position. So we've talked about whole body awareness, we've talked about pelvis awareness, and now we're going up to the rib cage. The rib cage is usually one that people are surprised that you're interested in, right? Because normally they've gone to PT before and no one's really talked about the rib cage. But the rib cage is really going to help you understand patterns of the upper extremity, just like the pelvis, like we previously talked about, is going to help you understand patterns of the lower extremity. But besides the shoulder and the arm and things of that nature, it also really helps understanding breathing and breathing pattern. So what I really like to do here is first off, check their infrasternal angle. And if you're not familiar with infrasternal angles, I have a whole entire course that dives a lot deeper into that. I will leave that in the link below. Feel free to check that out if you're interested. But I'm checking the infrasternal angle to see, are they wide or are they narrow? Why? Because that helps me understand their pattern even more. Based off that, I then want to have them take an inhale and take an exhale. A normal inhale, the chest should be able to expand and compress back down. When someone is severely patterned or limited or stiff, you can think of it like that, then they usually just have the belly breath. And so this gives me a lot of insight as to what breathing exercises is this specific person going to use. And then from an exercise standpoint, how do I want to position them to change that? How do I want to cue them to change that? And so again, just like we saw with the pelvis, them just learning about this, they're walking away with a totally different education and awareness of the rib cage. And that's going to really help you as you start to progress them into their exercises.